welcome again. This is a remote seminar today through the IFAM series, which is given in partnership with the Buehler Center for Health Policy and Economics. My name is Alex Lundberg. I'm an economist with the Buehler Center, and I have the privilege today of introducing our speaker, Dr. Anna Austin from UNC, from the Department of Health Behavior within the UNC Gillings School of Global Public Health. So her research really spans a diversity of topics, but has a clear focus on injury and violence prevention for children and families. And her presentation today is going to be addressing food insecurity through that lens. So I'm about to turn it over to Dr. Austin, but I do want to mention that through these Zoom calls, we will not be monitoring the chat function. So if you have any questions, please enter them through the Q&A function, and we will do our best to address them at the end of the talk. So thank you all. I'm going to turn it over to Anna now, and thank you so much for coming to give this talk with us.
Yeah, thank you for inviting me, and thanks for that introduction. And thank you everybody online for taking the time out of your afternoon to join today. As Alex mentioned, I'll be sharing a little bit about some research that I've been conducting over the last couple of years that's focused on assessing policies that address a critical social and economic determinant of health, food insecurity, and their potential to contribute to injury and violence prevention. Okay, so with some funding from the CDC, we have been examining the potential impacts of state adoption of policies that expand eligibility for the Supplemental Nutrition Assistance Program, or SNAP. So essentially, these are policies that increase the number of households that are eligible to receive food purchasing assistance through SNAP on rates of multiple health-related outcomes, including multiple forms of injuries and violence. And so today I'll be specifically talking about two studies we've conducted to examine the potential impacts of state adoption of these SNAP eligibility policies on rates of Child Protective Services investigative reports and rates of substance use behaviors and disorders among adults. To start us off, I wanted to give just a little bit of background and motivation for why I think we need policy strategies with the potential for widespread reach and the potential for meaningful population level impact to address specifically rates of Child Protective Services investigations and rates of substance use disorders and various substance use behaviors in the US. Okay, so first, thinking about Child Protective Services involvement, it's estimated that by age 18 years, more than 1 in 3 children in the US will experience Child Protective Services or CPS investigation for suspected abuse or neglect. And in addition to some immediate concerns for child safety and well-being, early experiences of abuse and neglect, involvement with CPS as a child, this is associated with an increased risk of poor health and development across the life course. So really, given both the magnitude and the potential consequences, I think it's really important that we try to identify prevention and intervention strategies that can reach large numbers of families and that can effectively address underlying factors that contribute to risk for suspected abuse or neglect and subsequent CPS involvement. So in terms of the prevention and intervention strategies that we have that can address this underlying risk for suspected child abuse and neglect, potential involvement with CPS, historically, a lot of our efforts have really focused on implementing individual and family level strategies. So for example, parenting programs, home visiting programs, these strategies that really focus on trying to develop parenting skills and fostering strong parent-child bonds. And so these individual and family level strategies, they are really beneficial for a number of families, and they are a critical component of comprehensive prevention efforts, but they are typically time and resource intensive, and scalability and sustainability are really challenging. In addition, something that I think is really important when we're thinking about these types of strategies is that they don't really address the broader context within which families and children exist, and within which caregivers are really trying to create safe and stable environments for their children. So as others have pointed out, these individual and family level strategies really assume that the parents, the caregivers, the family unit, that they have control over all of the factors that affect risk for adverse outcomes, like CPS involvement. And we know that this isn't the case. We know that children and families exist in this broader context, and that there are factors at the larger societal and community levels that can increase risk. So I often think back to a quote from a researcher who had a very long, very successful career. And she spent most of her career focusing on evaluating home visiting programs and their potential to prevent child abuse and neglect. And toward the end of her career, she said, we have to stop trying to fix families and we have to start trying to support families. And so for me, that really captures my motivation for wanting to focus on understanding the potential for broad population level programs and policies, specifically these economic, social, and healthcare policies, and their potential to create contexts that support children and families, help them thrive, and ultimately, hopefully, prevent CPS involvement. So in switching gears a little bit to think about substance use, as I'm sure most of you are well aware, the U.S. is in the midst of an ongoing overdose crisis. As you can see in this graph here, rates of drug overdose deaths in the U.S. have steadily increased over the past 2 decades, reaching an estimated 108,000 deaths due to drug overdose in 2021 alone, the similar estimated number in 2022, and these are the highest annual numbers ever recorded. In the U.S. currently, about 3 in 4 drug overdose deaths do involve an opioid, and right now that's primarily illicitly manufactured fentanyl. So like with CPS involvement, thinking about child abuse and neglect, given both the magnitude and the severity of the ongoing overdose crisis, prevention and intervention strategies that can reach large numbers of people and that can address underlying factors contributing to an increased risk for dying by a drug overdose are really urgently needed. So when I'm thinking about overdose risk and potential opportunities for prevention and intervention, I really like to use this framework that was developed by Park and colleagues in 2020. And so in this framework, here you can see it on the slide. On the left-hand side in red, this is our continuum of risk for fatal overdose. You can see there are multiple different points along this continuum, ranging from initiation of drug use, active drug use, development of a substance use disorder, and so on. And as you go up this continuum, the risk for a drug overdose death increases. One thing I will note here is that I think really importantly, this framework recognizes that this continuum of risk is not linear for people oftentimes. And so the doors and the staircase in the middle are intended to represent the fact that people can skip points along this continuum. They can move back and forth between points on this continuum. But again, sort of as you go up the continuum, the risk for overdose death increases. And then on the right-hand side in blue, this has some very broad categories of strategies that we can implement to try to reduce risk for a drug overdose death. So for example, things like evidence-based treatment, including medication for opioid use disorder, increasing access to harm reduction services like naloxone and syringe exchange programs. And so we do need strategies at all points along this continuum to effectively address the ongoing overdose crisis. And in this specific study I'll talk about today, we focused a little bit earlier on in this continuum. So we focused on trying to reduce risk for some potentially risky substance use behaviors and developing substance use disorder. And we took a public health approach by focusing on a social and economic determinant of substance use, food insecurity. So here we focused a little bit more upstream on a determinant that may affect demand for substances. And we really focused on examining the potential for a broad population level strategy to address this determinant and hopefully reduce risk and prevent an overdose death. Okay, so now that we've had some of that background and motivation, I'll move into talking more specifically about this first study we conducted that again focused on examining the impact of state expansion of SNAP eligibility on rates of CPS investigative reports. And so again, just to briefly mention, given both the magnitude and the potential consequences of CPS involvement and early experiences of abuse and neglect, really identifying effective prevention strategies that have population level impact is really critical. Existing research shows that food insecurity, which I'll define very broadly here as limited or uncertain access to enough food due to lack of money or other resources in the household, that this is one factor that contributes to an increased risk that a family will experience a CPS investigation. In thinking about how might it be that food insecurity increases risk for a CPS investigation, CPS agencies across the U.S. receive and respond to reports for a variety of behaviors, a variety of household conditions, including reports for suspected physical abuse, sexual abuse, emotional abuse, and neglect. Neglect is the most common type of allegation received and investigated by CPS agencies. Some recent estimates show that about 75% of all CPS investigations do include a neglect allegation. Neglect is a very, very broad category, but there are a number of neglect cases that relate to children lacking sufficient material resources like food, clothing, and housing to really ensure their safety and well-being. So it might be that experiences of food insecurity contribute directly to CPS investigations for neglect. In addition, in thinking about physical abuse specifically, we do know that experiences of food insecurity can increase caregiver stress. This has the potential to contribute to increased acts of physical aggression toward children, which may result in CPS investigations for physical abuse. And importantly here, food insecurity is not an uncommon experience among households with children. In 2022, 17% of households with children in the U.S., and this included more than 13 million children, they experienced food insecurity at some point during the year. The Supplemental Nutrition Assistance Program, or SNAP, this is the largest program addressing food insecurity in the U.S. Currently, SNAP provides a monthly benefit to more than 20 million low-income households. Many of these are households with children to assist with the cost of purchasing food. So to be eligible for SNAP, there are some baseline eligibility rules that are set at the federal level. At the federal level, households are eligible for SNAP if their income does not exceed 130% of the federal poverty level, and if household assets, including money and savings, land owning, and in some states, vehicles, does not exceed $2,750. While these baseline eligibility criteria are set at the federal level, states do have the option to expand on these criteria a little bit. Specifically, under a policy called broad-based categorical eligibility, states have the option to increase the income limit for SNAP eligibility to up to 200% of the federal poverty level. States also have the option to entirely eliminate the asset test used to determine SNAP eligibility. So this means that household assets, money and savings, land ownings no longer have to fall below that specified threshold. And over the last 2 decades in the U.S., states have adopted either one or both of these BBCE policies at various points in time. So we do have existing evidence indicating that state adoption of these BBCE policies that expand SNAP eligibility, that this results in increases in the number of households participating in SNAP, and particularly the number of households with children participating in SNAP, and that this subsequently contributes to decreases in the number of households experiencing food insecurity. And we hypothesize that these decreases in food insecurity would directly contribute to decreases in CPS investigative reports by helping more families meet a basic need for food. We also hypothesize that these decreases in food insecurity would contribute indirectly to decreases in CPS investigative reports by helping to decrease economic hardship, other material hardships in households, and really overall decreasing caregiver and child stress and conflict. So as you may have gathered, what we really wanted to do here, we wanted to examine the potential impact of state elimination of the asset test and increases in the income limit for SNAP eligibility under BBCE on rates of CPS investigative reports. And here I will note that this research we're doing It's informed by an advisory board we have of SNAP staff and leadership from several different states. And in talking to this advisory board, they indicated that of some of the different policies that state SNAP agencies can adopt, these two policies under BBCE are really critical for bringing more households into the program. They also indicated that in addition to bringing more households into the program, these two BBCE policies help to increase the stability of SNAP benefits for participating households. So for example, when states increase the income limit for SNAP participation, an adult in the household can accept a new job with higher pay without as much fear of losing SNAP benefits. When states entirely eliminate that asset test, households can build up their money in savings so they're prepared for an unexpected job loss or an unexpected medical bill, for example, again, without the fear of maybe losing their SNAP benefit. In talking with our advisory board, they also indicated that for them, trying to understand potential benefits of these two BBCE policies is really important because removing BBCE as a state policy option is regularly considered at the federal level, given that it does expand the program and it does cost some money. Okay, so what did we find in our study here? So this first graph is showing our estimated effect of state elimination of the asset test for SNAP eligibility on rates of CPS investigative report. And just to orient you very quickly to this figure, so along the x-axis, we have the number of years either before or after states eliminated the asset test. -4 is 4 years before, and 8 is 8 years after states first eliminated the asset test. On the y-axis, this is our estimated average difference in the number of CPS investigative reports per 1,000 children for states that eliminated the asset test compared to the counterfactual scenario in which they did not eliminate the asset test. And then our estimates of these average differences are shown in our blue and orange dots, with the blue dots showing these differences before states eliminated the asset test, and the orange dots showing these estimated average differences after states eliminated the asset test. So here we saw that starting 2 years after states first eliminated the asset test, there was a decrease in the number of CPS investigative reports, and the magnitude of this decrease increased with greater time since policy adoption. And over the entire post-policy adoption period, we saw on average there were 8.2 fewer CPS investigative reports per 1,000 children per year in states that eliminated the asset test, again, compared to that counterfactual scenario in which they did not eliminate the asset test. This is the same figure, except this time it's showing our estimated effect of state increases in the income limit for SNAP eligibility. Here we found that starting 4 years after states first increased the income limit, there was a decrease in the number of CPS investigative reports, and the magnitude of this decrease increased just a little bit with greater time since policy adoption. And over that entire post-policy adoption period, we saw on average there were 5 fewer CPS investigative reports per 1,000 children per year in states that increased the income limit, again, compared to the counterfactual in which they did not increase the income limit. All right, so last we looked at state adoption of both of these SNAP eligibility policies. So when states both increased the income limit and eliminated the asset test. Here we found that starting 3 years after states first had both of these policies in place, there was a decrease in the number of CPS investigative reports. Again, the magnitude of this decrease increased with greater time since policy adoption. And over that entire post-policy adoption period, we saw on average there were 9.3 fewer CPS investigative reports per 1,000 children per year. Okay, so those results I just showed, they were for all CPS investigative reports. We also examined the impact of state adoption of these SNAP eligibility policies on CPS reports, specifically for neglect and specifically for physical abuse, given that the underlying mechanisms by which state adoption of these policies may impact reports for neglect and for physical abuse may differ. So here we found that, again, state elimination of the asset test increases in the income limit and adoption of both policies. These resulted in decreases in total CPS investigative reports, as well as CPS investigative reports specifically for neglect. We also found that the increases in the income limit and adoption of both policies resulted in some small decreases in CPS investigative reports for physical abuse. I also want to note that in doing research on child abuse and neglect, it is really critical to recognize that due to structural racism across multiple systems, Black families are disproportionately represented among those involved with CPS. So it's estimated that by age 18 years, 1 in 2 Black children, as compared to 1 in 4 white children, will experience a CPS investigation for suspected abuse or neglect. Given this, we examined whether there were differences in the impact of state adoption of these SNAP eligibility policies on rates of CPS investigative reports for Black children and white children separately, to examine the potential for these policies to contribute to reductions in this existing racial disproportionality that we see in CPS involvement. These two figures these are showing the effect of state elimination of the asset test for SNAP eligibility on rates of CPS investigative reports separately for Black children and for white children. These are just intended to provide an example and a visual illustration. What we found overall in these analyses was that the elimination of the asset test, increases in the income limit, and adoption of both of these policies, that this all resulted in similar levels of decreases in CPS investigative reports among Black children and white children. Okay, so just to summarize all of those results and provide a little bit of additional context. Again, we found that state adoption of all of these SNAP eligibility policies resulted in decreases in total CPS investigative reports and specifically reports for neglect. We also saw that the increases in the income limit, as well as adoption of both of our policies, that this resulted in some small decreases in reports for suspected physical abuse. So again, I'll just note that neglect, again, a very broad category, but it does often relate to children lacking access to basic needs, including food. And so state expansion of SNAP eligibility means that more families are receiving assistance meeting a basic need for food, and this may contribute directly to reducing the number of CPS investigative reports for neglect. Again, decreasing reports for physical abuse. In contrast to neglect, this does require changing caregiver behavior. And it is possible that if more households are receiving food purchasing assistance through SNAP, more caregivers are getting greater stress relief, resulting in fewer acts of physical aggression toward children. However, a single sort of economic social support policy here in terms of expanding SNAP eligibility may not be sufficient to really have large changes in caregiver behavior and achieve substantial reductions in CPS reports for physical abuse. And last, we found that state adoption of these SNAP eligibility policies resulted in similar decreases in CPS investigative reports among both Black and white children. And so to address the existing racial disproportionality we see in CPS involvement, we would need to observe larger reductions in CPS investigative reports among Black children than among white children. And so in the context of ongoing structural racism, while expanding SNAP eligibility and helping to decrease food insecurity may contribute to decreases in CPS investigative reports for both Black children and white children, this may not be sufficient to really reduce or narrow this existing racial disproportionality in CPS involvement, and more concerted efforts really focused on addressing structural racism are likely needed. I want to acknowledge that because of structural racism, again, across multiple systems, there are additional racial and ethnic groups, including American Indian and Alaska Native families, that are also disproportionately represented among those involved with CPS. Our public health research that we do with survey and administrative data can often contribute to erasure of populations that are smaller in size or for whom we don't collect accurate data. For our study here, we did have smaller numbers of American Indian, Alaska Native children in several states and years in our analyses, and this created some issues with our analytic approach. However, I do want to acknowledge that as a field, we need to be doing better, thinking creatively, and developing solutions to addressing this issue of erasure so that all populations are represented. The Urban Indian Health Institute, which is a tribal epidemiology center, has a really great set of best practice recommendations for data collection among American Indian and Alaska Native populations to ensure accurate representation. We do need to be thinking more sort of on the back end, what do we do at the data analysis phase of this? One recommendation they have is aggregating data over time to try to build larger samples to overcome this issue of smaller sample sizes. Okay, so transitioning to talk about our next study, which here we looked at the impact of state expansion of SNAP eligibility on rates of substance use behaviors and disorders in the U.S. So again, as previously mentioned, the U.S. is in the midst of a continually worsening overdose crisis. Existing evidence does indicate that food insecurity is associated with an increased likelihood of engaging in potentially risky substance use behaviors and developing a substance use disorder. There are a couple of different mechanisms that potentially underlie this association. The first, substance use may be a coping strategy to deal with the stress and psychological strains associated with not having reliable access to food. In addition, there's research showing that some people experiencing poverty use psychoactive substances like opioids to try to curb hunger and suppress appetite as a way of dealing with lack of access to sufficient food. And last, there's also research suggesting that chronic pain is more prevalent and more severe among people who experience food insecurity, perhaps due to chronic stress and nutrient inadequacies. And this may lead to substance use as a method for coping with that physical pain. Overall, it's estimated that nearly 70% of those who do have a substance use disorder are also currently experiencing food insecurity or have previously experienced food insecurity. Okay, so in thinking about state expansion of SNAP eligibility and its potential impact on substance use behaviors and disorder, again, we wanted to examine the potential impact of our two policies under BBCE. So again, state increases in the income limit for SNAP eligibility and state elimination of the asset test for SNAP eligibility. And for this study, we also wanted to examine an additional policy. At the federal level, the 1996 Personal Responsibility and Work Opportunity Reconciliation Act, which is a mouthful, this act imposed a lifetime disqualification on SNAP participation for anyone with a drug felony conviction. However, again, here states do have options when it comes to this policy. So some states have opted to modify this ban, meaning that those with a drug felony conviction can participate in SNAP under certain conditions. For example, in some states, a person with a drug felony conviction can participate in SNAP if they submit to regular drug testing. I will note that these modified bans do tend to still be pretty restrictive, and they are quite variable across states. In addition, some states have chosen to opt out entirely from this federal drug felony ban, meaning that in these states, those with drug felony convictions can participate in SNAP with no restrictions. And just to orient you to how we wanted to look at these different state policy combinations in our study, what we did was we categorized each state and year into one of four categories according to these different policy options. So our first category, this was states that had entirely opted out of that federal drug felony ban, meaning they allowed people with a drug felony conviction to participate in SNAP with no restrictions. And they had adopted at least one of our BBCE policies. So they had either eliminated the asset test, increased the income limit, or adopted both of those policies. The second category, this was states that had entirely opted out of the drug felony ban, but had not adopted any BBCE policies. The third category was states that had maintained the federal drug felony ban. And here we did include both lifetime and modified bans, again, because those modified bans still tend to be pretty restrictive, and had adopted at least one of those two BBCE policies. And then our fourth category, this was used as our reference group, our comparison group in all our analyses. And this was states that had maintained that federal drug felony ban and had not adopted any BBC policies. So really weren't expanding SNAP eligibility under either of these policy options. And we examined these different state policy options with respect to rates of substance use disorders, illicit drug use disorders, alcohol use disorders, and opioid misuse. And here opioid misuse included both misuse of prescription opioids and heroin use. We examined these rates among adults using data from the 2015 to 2019 National Survey on Drug Use and Health state level small area estimates. Another mouthful there. Okay, so what did we find in these analyses? This figure has a lot going on, so I'll sort of walk through it piece by piece. First, what we found was that states that expanded SNAP eligibility by entirely opting out of the federal drug felony ban and adopting at least one of those two BBCE policies, that these states had lower rates of substance use disorders, illicit drug use disorders, alcohol use disorders, and opioid misuse compared to states that maintained the federal drug felony ban and did not adopt either of those BBCE policies. Second, we found that when we compared states that did not adopt any BBCE policies, that states that opted out of this federal drug felony ban, these states had lower rates of substance use disorders and illicit drug use disorders as compared to those states that maintained the federal drug felony ban. But we did see similar average rates of alcohol use disorders and opioid misuse between these states. And then third, we found that among states that maintained this drug felony ban, regardless of whether these states adopted any of our BBCE policies, these states had similar average rates of all of our substance use outcomes. So here for us, this really emphasized that adopting these BBCE policies in the absence of opting out of that federal drug felony ban really didn't contribute to changes in rates of substance use outcomes among adults. Okay, so to summarize these results, again, we saw that their rates of all of our substance use disorder and behavior outcomes were lower in states that both entirely eliminated the federal drug felony ban and adopted at least one BBCE policy, as compared to states that didn't expand SNAP eligibility under either of these policy options. When we further looked at some of these different policy combinations, again, this highlighted for us the importance of removing that federal drug felony ban, specifically for substance use outcomes. So first, we saw that among states that did not adopt any BBCE policies, those states that did entirely opt out of the federal drug felony ban had lower rates of substance use disorders and illicit drug use disorders, which are outcomes that are more indicative of illicit substance use, a behavior that may be more likely to result in a drug felony conviction and perhaps more likely to result in a drug felony conviction as compared to alcohol use. And then last, we saw that among states that maintained this drug felony ban, states that adopted at least one BBCE policy had similar average rates of all our outcomes as compared to states that didn't adopt BBCE policies. So again, demonstrating really little benefit of adopting these BBCE policies alone in the absence of opting out of that federal drug felony ban for addressing rates of our substance use outcomes. Okay, so in terms of thinking about some of the implications of these results, these studies are just two among a growing evidence base on the potential for policies that provide increased economic and material support to contribute to decreases in injury and violence at the population level. These include policies like higher state earned income tax credits, higher state minimum wage, state Medicaid expansion, and paid family and medical leave policies. And there are a number of amazing research teams, some listed at the bottom of the slide, who are doing research in this area on these policies. And so it's not likely that any one of these policies alone is going to be sufficient to prevent all child abuse and neglect, or all CPS involvement, or all drug overdose deaths, but perhaps sort of a range of different supportive policy strategies can better support individuals, families, and communities, and contribute to large sustained reductions in many of our pressing public health issues. And I do think this is an important area for future research to try to understand which policy combinations are feasible and which can have the greatest impact in addressing some of these issues. I also think it's really important in this continued research to assess the impact of these different types of policies on outcomes that they're not necessarily intended to address. So state expansion of SNAP eligibility, this isn't necessarily intended to address rates of CPS investigative reports, but looking at these outcomes that these policies aren't necessarily intended to address can really help us to understand the totality of the potential benefits of these policies and build evidence base to support them if warranted. I also think it's really critical in this continued research that when possible, that we examine whether access to and the potential benefits of these policies are realized for all populations, because inequitable distribution of these policies and their potential beneficial impacts may contribute to widening of gaps and disparities in outcomes that we see for marginalized and oppressed populations, and specifically minoritized racial and ethnic people. I will note, that state level data we had from the national survey on drug use and health, it didn't have, estimates by race and ethnicity, so we were unable to examine that there, and that's a gap in our research. And then last, I'll note for when thinking about this research, in the study on state expansion of SNAP eligibility and rates of CPS investigative reports, we started seeing some decreases 2 to 4 years after states first adopted those different policies. And so while I think that these different policy strategies can be really critical to achieving sustained population level impact, they're typically longer term strategies that don't yield short term results. And so getting buy-in from those who really want to see immediate impacts and have sort of that immediate bang for their buck is really challenging. And so I think as a field, we need to be thinking about how we communicate and message the potential benefits of these different policies effectively so that we can get buy-in. And I did also want to, mention the COVID-19 pandemic context, specifically when it comes to thinking about some of these social and economic determinants of health and when it comes to thinking about different policy strategies. So as you can see on this graph here, the percent of households experiencing food insecurity, the percent of people living in poverty, and specifically the percent of households with children experiencing food insecurity, and the percent of children living in poverty, these all decreased substantially in 2021. So I think the fact that food insecurity and poverty did not increase in the midst of the COVID-19 pandemic, when we were experiencing really unprecedented health and economic hardship, is a testament to some of the robust economic supports that we put in place during the pandemic. So for example, in 2021, we had the expanded child tax credit, which gave a benefit to families with children. In addition, starting in 2020, a number of economic support policies, social health support policies were put into place. So for example, emergency allotments in SNAP were implemented in 2020. So this meant that any household participating in SNAP got the maximum amount of benefits allowed for their income level. This really helped support a lot of families. At the federal level, these emergency allotments ended in 2023 with the end of the public health emergency, but there were 18 states that ended these emergency allotments early in 2021 and 2022. So, that being said, we had all these policies going on, put together this sort of robust social safety net, economic support, particularly for families with children. And while I do know that disentangling the impacts of these different policies from other COVID-19 pandemic-related impacts will be really hard, I do think these different policies these policies coming online and then going away offers us a unique window of opportunity to further understand the potential implications of these types of policies for a range of health-related outcomes and to understand what we might want to support and implement in the future. Okay, so I do want to take a second to thank all of my wonderful collaborators at UNC who provided so much expertise and insight. And I also want to give a huge thanks to our advisory board for this broader grant. They have provided invaluable guidance in really understanding how SNAP works and specifically understanding how some of these policies work within the program. Okay, so I talked a little bit faster than intended, but also wanted to leave plenty of time for question and answer. And so can start that now. I do see we have a question already from Lindsay Allen, so I'll go ahead and read that to everyone and see if I can give it an answer. So Lindsay shared that a prior study found that imposing SNAP waivers worsens anxiety and depression among women with SNAP, but less so with men. Could the same thing happen here? Larger effects among woman-to-child abuse/neglect compared to man-to-child, as women are still largely responsible for family feeding and might feel the impact of food-related policy more acutely in the U.S. Do your data allow you to break this out by adult gender? That's a really good question. In the data that we have, so the data we used for this study come from what's called the National Child Abuse and Neglect Data System, or NCAN. So it's mandated at the federal level that all state child protective services agencies submit data on reports they receive and investigate up to the federal level. And then at the federal level, they have to make those data available. So we have data on CPS investigative reports from all 50 states and DC. And in those data, there is information on the alleged perpetrator of the abuse and neglect. There's also some information on the household composition. And so, I think that's a good point that maybe in some future research, perhaps understanding the impact for households where there's a single caregiver, households that are headed by a single woman as compared to, households that have two primary caregivers. That may be important for understanding the types of households that maybe benefit more or less from this expanded SNAP eligibility and receiving food purchasing assistance. I'll also note both of these studies we conducted are entirely ecological. They're all at the state level. And so would love to at some point figure out a way to look at the potential benefits of newly gaining access to SNAP under these policies at the individual level for a range of different outcomes, particularly for families with children. But yes, I agree with your point that you made here and think that continuing to understand who these populations work for and maybe how they work differently for different populations is important. And a question from Steve, have I looked at the low-cost food plan under SNAP versus the thrifty food plan? No, I haven't. That is a good question. Yeah, I think there's still so much to explore here with respect to how SNAP is implemented, the different policies under SNAP. We saw with in 2023 that they did revise the thrifty food plan and SNAP, so SNAP benefits increased for everyone to account for inflation. Anecdotal evidence suggests this is still not enough to keep up with rising food costs, particularly in the context of those emergency allotments and SNAP decreasing. So I do think, that's a point, that's another area for future research.
Thank you all. If I could, I'd like to ask one question too.
Please.
For a state that wants to expand SNAP, I could think of at least 3 points of focus. One would be the level of the benefits themselves, which tend to be low. Another could be the expanded eligibility thresholds to try to get more coverage. Mm-hmm. And a third could be trying to connect people who are currently eligible but are not connected to benefits. And I'm curious if you think that among those attempts to expand, is there one that's more of a critical unmet need than any other?
That's a really, really good question. I know it does vary across states in terms of of the population that's eligible in a state, what percent of the population actually is enrolled in SNAP and receiving those benefits. So, you know, in some states it's like 90%, in some it's a much lower percent of the population eligible that's enrolled in SNAP. You know, there have been other strategies that have been implemented and that most states have put in place to try to increase that enrollment among the eligible population, like allowing online applications, really getting rid of the recertification process, having to be in person at a SNAP office, streamlining that recertification process. And there have been some prior studies that have examined that and have shown that that helps to maintain SNAP benefits, get more households into SNAP. So I think that's one area where they've done that. I also know, I think this is a really creative strategy. I have a colleague in North Carolina who, in North Carolina, if a certain percentage of a school, public school population is receiving free or reduced, or is enrolled in SNAP benefits, then the entire school gets free or reduced cost lunch. And so what they've done is they've gone into schools, tried to make sure that every family that's eligible is enrolled in SNAP, try to meet that minimum threshold for SNAP enrollment for the school, so that every family gets free and reduced lunch. There's no stigma associated with it. People don't have to enroll in it, self-identify for it. And so while that doesn't really address SNAP enrollment, to your point, it just kind of helps you address food insecurity and make good use of all the programs we have available. And I think really in talking to our advisory board of the staff and leadership from different SNAP agencies, they really drove home that those two policies under BBCE are the two for them that are the most important for getting more households into SNAP. So increasing the income limit all the way up to 200% of the federal poverty level, and then also eliminating the asset test. They also said that getting rid of that asset test is a huge administrative efficiency for them. It frees up so much time because figuring out all of those assets, calculating the total, figuring out who falls below that threshold is really complicated. So they have an additional reason for really liking those two BBCE policies. So I don't know if that fully answers your question, but I think people are trying different strategies, trying to be creative. And I think, you know, there's some early evidence indicating that those emergency allotments in SNAP helped to keep food insecurity from really skyrocketing during the pandemic. And that once those emergency allotments went away, food insecurity started increasing again. So to your point there too, about increasing the minimum benefit amount, I think that's also important. One thing I would love to partner with economics colleagues on is like doing a cost benefit analysis, sort of trying to figure out, you know, what is the average cost of a CPS investigation and what is the cost of expanding SNAP eligibility, and do we see that we have greater cost savings in terms of prevented CPS involvement. You could also think of, you know, the prevented sequelae of early CPS involvement for later health outcomes, and, you know, really how all of that plays out. So maybe there are some economists online who would like to partner in figuring out how to do that.
Well, great. Well, thank you so much. If there are no other questions, I think we could close for today, but I want to say thank you again for the presentation, for the really fascinating and important work.
Yeah, thank you so much. And thanks for the invitation. It was great to get to share this with a new audience.